Good afternoon.
Good afternoon, Madam Chair.
Welcome to the Senate Finance Committee. Today is Friday, March 13th. Yes, Friday the 13th. And the Senate Finance Committee has 3 bills today and 4 witnesses. But we have 2 voting lists, so we'll be here for a while. We're only going to hear 3 bills. So, Senator Mounts, are you ready? We're going to start with Senate Bill 969, Health Insurance, Lyme Disease, and Related Tick-Borne Illnesses, and it's only Senator, no panel. Thank you, Senator.
Thank you, Madam Chair, Mr. Vice Chair, distinguished committee members. It's an honor to present Senate Bill 969. In 2024, Maryland reported 2,035 confirmed and probable cases of Lyme disease, a 30% increase from 2023, making it the most commonly reported tick-borne disease in the state. While 2025 data is not fully available, the trend indicates continued prevalence of Lyme disease in Maryland, and the CDC has put Maryland in the high-risk category based on the numbers of confirmed cases. Lyme disease enters the human body via an infected ticks. When caught early, a couple weeks of antibiotics can usually wipe out the bacteria. But if the disease remains undiagnosed and left untreated, severe and debilitating nerve damage can occur. Unfortunately, the medical community is divided over how to treat Lyme's disease, with one camp advocating for long-term antibiotic treatments. The other camp disagrees as to its efficacy. Insurance companies exploit this divide between the 2 schools of thought by siding with the cost containment, excluding coverage, and denying claims, often for any Lyme treatment, but particularly for long-term treatment, leaving patients footing the bill. And then that is the issue of this bill. This bill would provide coverage for long-term antibiotic treatment for Lyme's disease. Colleagues, I'm not sure. I can't imagine that you haven't experienced constituents with Lyme's disease. It is an issue we have looked at in many different ways throughout my tenure in the General Assembly. This bill is focused specifically on that issue of coverage for the antibiotics. It's not a universal coverage. It's determined by general practitioners that are treating patients, and it is something that has been asked for a number of different reasons. But one is when you get into long-term care, oftentimes there seems to be no hope, and you have to make a decision on what to do. And when a doctor says you need antibiotic, the patient obviously wants antibiotic, and it's not guaranteed that the insurance company will cover that. So with that, I'd urge a favorable report, and I appreciate your attention.
Senator, thank you. Have you read the letter from the Department of Health?
I have read the letter from the Department of Health. Thank you.
Thank you. That's all I'll say. Do I have any questions for the senator? That ends the hearing on Senate Bill 969. Senator Hayes, we're going to do 972, Baltimore City 40th Alcoholic Beverages District. I love these bills. And you're bringing up Michelle from the Board of Liquor License Commissioners. Thank you.
Good afternoon, Madam Chair, members of the Senate Finance Committee. Senator Antonio Hayes, representing the 40th Legislative District in Baltimore City. I'm here today to present Senate Bill 972. Joined with me is Michelle Wurzberger from the Baltimore City Liquor Board of Commissioners. This bill, as introduced, creates 2 new licenses. One is for a small business that's relocating from the downtown part of our district to the Picktown community, long-standing restaurant called Black and Blue. It does not meet the seating requirement, and so we're making an exception in their seating requirement so they can relocate into the Picktown community. The other establishment is a non-dairy based creamery that has certain products that they would offer alcohol to. Neither of these licenses allow for off-site consumption, and both of them require, as I always do when creating new licenses in a district, require an MOU that's signed by the community in which they're a part of. The other part of this bill is a technical amendment to give the Board of Liquor Commissioners the authority to waive one of the requirements of a C license. And lastly, we prior to 4 years ago, my district, the 40th district, used to be shared along the Wilkins Avenue corridor with another district, the 44th district. And at that time, we limited the hours. And traditionally, we work with the Baltimore City Police Department to identify areas throughout the city where there's high prevalence of homicides and shootings. And in those places, we limit the hours of the liquor stores. In all cases, when we have done this, crime has reduced dramatically in those areas. And we simply limit them from 10 a.m. to 10 p.m. operating hours, as opposed to the standard 6 a.m. to 2 a.m., whereas they're only closed for 4 hours out of a 24-hour period. I am in receipt of some concerns by one of the business owners. I think they have representatives here. I plan on following up with them as well as the Baltimore City Police Department. But typically when we make these recommendations, it's usually at the recommendation of the police department. And so we will work them out in the community. With that, colleagues, I urge a favorable report for Senate Bill 972.
Thank you, Senator. Do you want Michelle to testify? Or you?
Ditto. How about that?
Easy
All
testimony.
right. Senator Washington has a question.
Thank you, Mr. Chair. Thank you, Madam Chair. Mr. Vice Chair, thanks for this bill. You mentioned something about the community MOU.
Yeah.
I love the concept. Can you just explain what that is?
Yeah, so typically whenever I create a new license, whatever community that they're a part of, we mandate that they do an MOU with that business. And when the MOU is required in the law, it has the same effect of the law. And in some cases, the community will negotiate certain things like you can't sell what we refer to as shorties, right? Because shorties are typically a cheap, something that typically maybe kids or people that may have an alcohol abuse would take care of, or they may mandate like different things that they could sell. So there's certain things that the business will negotiate with the community. And then once they come to an agreement, they present it to the liquor board, and the liquor board makes that a part of the record, and they hold them to whatever enforcement involved in that MOU that they agreed to.
That's restaurants, liquor stores, every licensee?
Yeah, whenever we create new licenses.
From here?
Yes,
Got it,
yes.
okay.
When we create new licenses from the legislature, my commitment is to the community in which these businesses are located.
Great idea.
And just to follow up on your question, for many years, the law had provided the ability for the board to make those MOUs a part of the license. There were a couple of licenses that had inadvertently been excluded, and last year the delegation closed that hole. So it does apply to all licenses that we have that ability to then enforce that agreement if the licensee voluntarily agrees to the terms.
Got it. Now, now, who is the community? Because, some communities have a civic association, HOA, a condo association nearby. Who's determined by this?
In the city of Baltimore, communities register with the Baltimore City Department of Planning. And so there is a list of community associations, and typically I know what community association it is. But whatever community that the business is located in within their boundaries, we usually, and it's specified here. In the case of the one in Pigtown, it would be the Berry Circle community. And then in the case of the one on Charles Street, it would be the Mount Vernon Belvedere Association. I know both of those community leaders very well. This wouldn't be the first time they've done an MOU, and so they're used to it, and they understand that's what they have to do.
I think it's great. Exactly what we need. So I plan to adopt that. Thank you.
I've given you a lot of good ideas.
No, you have not.
Thank you, Senators. Any other questions for Senator Hayes on Senate Bill 972? That ends the hearing. Thank you, Senator. Now I have Senate Bill 974, Caroline Alcoholic Beverages Inspector, and actually Senator Mouths is going to present it.
Thank you, Madam Chair. Committee members, it's an honor to present Senate Bill 794. This is pretty much a house cleaning measure. Currently, law requires Caroline County Codes Administrator to be the liquor inspector. This was recently brought to the county's attention. They weren't aware of it. They have a separate individual who is their liquor inspector, not the code administrator. And so what this legislation does, it just updates modern day current practice, and it allows the code inspector or their designee to do the liquor inspecting in Caroline County. It is a local bill. It's been approved. It has zero opposition, and I'd urge your favorable report.
Do I have any questions on Senate Bill 974? That ends the hearing. Thank you, Senator Mounts. And that ends the hearings for today. So we're going to give Tammy a couple of minutes, and then we'll be doing our voting list. Everybody get the two voting